Welcome to AI Rounds, your weekly dose of AI in medicine and education.
We are your hosts, Dr. Núria
and Dr. Morgan Leaf. Each week, we'll bring you a quick dive into the latest in artificial intelligence and how it's transforming healthcare, medical education, and medical communications.
From the tools changing how we teach, learn, and write, to breakthroughs shaping patient care. If it's new, exciting, or just plain useful, we're talking about it.
In just 10 to 15 minutes, we'll get you up to speed and maybe even spark your next big idea.
Let's make the rounds.
Hey, Núria, how are you?
Hi, I'm doing well. How are you, Morgan?
I'm good. I'm excited to be filming episode 8 with you, where we're going to be talking about the evolving role of CME as AI becomes integrated into clinical practice. So in our last episode, we touched on some of the information you learned at the Change Med Ed conference, which was geared towards medical students and residents, and how this is really changing teaching practices. And we're also seeing AI being more and more integrated into clinical practice, especially for radiologists, pathologists, in electronic medical records. We touched on that a little bit. A big way that AI is now being integrated into many types of medical practice is as a note taker in the room, which just saves a ton of time for physicians who previously dedicated hours and hours to writing notes about their patient visits. So it's really showing up in multiple places in the operating room too. And what does this mean for the continuing medical education that we provide? So what do you think about that, Núria?
I think that is a key question that I'm still trying to figure out, right? Because we have two things at the same time. One, we have all of these people coming out of graduate and undergraduate medical education who will go into the workforce and are now used to these AI tools being embedded in their education, and will probably want them to be embedded in their continuing education. On the other hand, we have all of this population of practicing clinicians who have not experienced the AI boom in medical education and might be less familiar as well with AI tools, who need to, one, get a lot of AI literacy education, and then how to integrate these new tools in their education and how to use them in clinical practice. So I see like a lot of places where we will play a role, and I think we need to talk more about this as CME providers, as continuing education providers. We need to talk more about not just how to use AI to do our jobs as providers, so to create content, but also what is our role in educating the clinicians about AI, etc. What do you think?
Absolutely. Yeah, I totally agree. I think we need more education out there. And I think this is an important place to sort of pause, take a step back and say, because we so often, almost always, when we're talking about CME as medical writers, we're really talking about the tiny sliver of continuing medical education that is supported by pharmaceutical grants, right? Because that's most of our clients and employers. But in the grand scheme of things, as a practicing physician for the past, I don't know, how long have I been doing CME? I graduated from residency in 2009. So I've been doing CME for 16 years. I have never participated in, I'm sorry, my clients, I have never participated in a pharmaceutical supported CME activity. I always got all of my CME when I was practicing from grand rounds at my institution, from conferences that I attended in person, from other types of activities. So in the grand scheme of things, to most physicians, this pharmaceutical supported CME is a very small piece of the pie that's going to vary by the specialty of the physician. But I bring that up because I think it's important to think about who is in a position and maybe has either a financial interest or an ethical obligation to educate physicians on this topic. And that's kind of where the mystery lies to me right now, right? I mean, who do you see as who should be the responsible party for educating physicians on AI?
I mean, that's maybe the AI companies. should give us grants for that. That is a key question. But like, I think it is also interesting that I think more than 40% or up to 40% of the membership in the alliance is actually hospital systems
Hmm.
and not mechs, right? So when, even though the education that me and you as medical writers are mostly involved with is the pharmaceutical supported education, a lot of the people in the alliance are not actually producing that type of content. They're producing the type of content that you were talking about. And I feel like if no one else is going to support the AI literacy and all of that type of education, it will fall on the hospitals and on the professional societies. The question is, do they reach everyone? And I think that there's a good argument there to make that actually no, they do not, right? So they don't reach the community, most of people that are in community hospital settings or community private practice settings that don't have access to like these big academic hospitals. So yeah, so there is a big question of like, as we transition society to this new AI assisted way of practicing medicine, who's going to pay for all the AI literacy content? I don't know.
Yeah, I mean, I think back to, oh my gosh, I've been through so many Epic rollouts in my career
Mhm.
because of the exact age I am and when Epic
Yeah.
came to be. So I've been at least 4 hospitals as they rolled out Epic. And I think in that scenario, many physicians understandably get frustrated because it's just presented as a task and not an
Mhm.
opportunity for education. So it's like, here's a little bit of training and go, and we're live, and here's this person with the vest on who can help you muddle through on your first day. And if I had to guess, again, I'm not in clinical practice anymore, but if I had to guess, that's probably what's going on right now as AI tools roll out in hospitals, in operating rooms, in patient visits with these note-taking tools. And so it's probably like, oh, the salesperson is there to help you, and in a way that gets the job done. And it some people might be fine with that, but it also seems like a really ripe opportunity for education that would make clinicians more comfortable with the technology, because we as physicians are very curious people, right? Like, we want to know what's behind it. We want to understand it. We like to know 100% of everything about what we're doing before we do it, because that's how we're trained.
Mhm.
But at the same time, I don't know who is, like we said, the person who should take the reins on that. But I do think we need more of it, because these things are coming out rapid fire. And as a busy physician, like, you're already working a 12-hour day and doing so many things and taking care of so many patients, et cetera, et cetera, et cetera. Making it sort of an annoying task is less ideal than making this sort of a joint partnership with physicians as you roll these things out. And I think that's what CME has the opportunity to do.
Yes, 100%. Like, as we always say in CME, like, medicine itself is advancing at such a rapid fire that that is the role of physicians, is to keep up with the medicine, right? And one thing that Andy Krim told me a couple of days ago was that the implementation of the electronic medical records actually led to like quite a significant exodus of older clinicians.
Absolutely.
And there are so many medical specialties like that we cannot lose, we cannot afford to lose more clinicians. So like, managing the rollout of AI implementation in a way that doesn't make people want to retire, I think is critical. It's critical, like, from a country point of view. And I think really we need to be in this conversation as the people that educate providers. I feel like people in continuing education should be the ones leading this conversation.
Yes, I agree.
Yes.
So we just need to find the person who's willing to fund it.
Yes. And then we can do it. So I heard there was a session at the Alliance this year. There was a medical education company that was able to get some funding for AI literacy, and
Mm.
what they shared was go to supporters at the end of their budget year when they have leftover money. So
Fair.
anyone
Fair.
is wondering where to get money, that is a way to go, is wait for the end of the budget year and then ask supporters for leftover money for AI literacy.
Well, to your point earlier, maybe the answer is pulling these AI companies into the
Mhm.
CME world, right? The disconnect could be that because there's a ton of AI startups out there, right? Like
Yeah.
more than we could count. And we're very siloed. They're in a different silo. They may have absolutely no idea what
Mhm.
continuing medical education is.
Right.
And so maybe the idea is that we need to be ambassadors for this field and pull them into the loop because that's a very appealing concept usually to certain companies. Oh, hey, physicians can get educational credit and this stamp of approval that what I'm providing is unbiased, right? Because like nobody is more skeptical about new technology than physicians. Like we want all of the facts and figures, and we do not trust people who are making money on it, like anytime. So if you get that stamp of approval from CME that says, hey, this has been reviewed, it's unbiased, that's really beneficial to these AI companies. So, okay, is this going to be another podcast where we come up with an idea that now we have another project for ourselves, Núria?
Exactly. I can see that you're becoming a business development person and not me to go. Talking
So
over
maybe
there,
what we
Google.
need, yes, that's what we need to be doing. We need to be going
Yes,
out to these bigger
100%.
companies and
I
saying,
mean, they
hey,
have funds for stuff, right? And they're
mhm.
like throwing trillions of dollars into this. Like, surely they can give a little bit of a few million, for CME. That is my opinion.
I agree completely. Yeah.
Hmm.
Okay. So we need some ambassadorship between the CME world,
Yeah,
the alliance world, and the AI world. So let's put that on our to-do list for 2026.
100%. It's
Okay.
there.
Love
Yep.
it.
All right. Okay, Morgan. Thank you again for this episode, and I'll see you next time.
See you next time.